Good afternoon, friends. The topic of my assignment is prepartum cervicovaginal prolapse and its management in buffaloes. Prolapse literally means displacement of organ or part of the body from its normal anatomical position, especially downwards or outwards, after resulting into protrusion from its orifice. This cervicovaginal prolapse is a protrusion of various parts of vaginal wall along with cervix through the vulva. The condition many times, if not managed in time, can be a lethal and life-threatening to the animal. Incidence and causes. The incidence of cervicovaginal prolapse has been observed high in case of ruminants, especially in buffaloes as compared to cows or sheep or goat. This occurs mostly in the last 2 months of gestation and is commonly seen in pluriparous animals as compared to primiparous animals. The main important causes of cervicovaginal prolapse is low plane of nutrition, hyperestrogenism by eating the fodder containing the estrogenic contents, the fodder deficient in calcium, magnesium, and phosphorus, excessive relaxation of the pelvic and the perineal regions, excessive deposition of fat in perivaginal connective tissues, increased intra-abdominal pressure, especially during the late pregnancy. These are the most important causes for the cervicovaginal prolapse. As far as symptoms, it is very clearly visible that the protruded mass can be seen out through the vulva. Many times, it also occurs through the rectum and it's termed as rectovaginal prolapse. The protruded mass is soiled with feces, straw pieces, dirt, blood clots, etc. There is severe straining, animal is restless, anxiety is there, pain, and reduced feed intake, anorexia in some of the cases. There is, more importantly, the urinary inconsistency. Therapeutic management, as far as this therapeutic management is concerned, it is based on the 3R principles. One, reduction of the size of the prolapse. Second, reposition of the prolapse. And third is retention. The prolapsed mass, when it is reposited, it must get retained to its original site and position. So these 3R principle works for managing a case of prolapse. Here are the photographs in which first photograph shows prepartum prolapse. Then you can see that it is being reposited, completely reposited, and after that, by applying a rope truss, we can maintain or the entire prolapse mass. Treatment, this basically is a more symptomatic. Anesthetic for handling the case is very much necessary. Injection 2% lignocaine hydrochloride at dose rate of 10 ml epidurally. You can give tranquilizers for avoiding the straining by applying injection sequel at the rate of 0.2 milligrams per kg body weight intramuscularly. Analgesic for relieving the pain includes injection xalazine 0.3 ml plus 4 ml distilled water epidurally. Hemostatics to avoid the bleeding by using the injection at chrome at the rate of 10 ml intramuscularly. Antihistamines like chlorpheniramine maleate at the dose rate of 10 ml intramuscularly. Fluid loss is there, so we can go for this fluid therapy by injecting B5 vingerlactate solution intravenously. Injection calcium borogluconate at the rate of 225 ml. It's to be given slowly. NSAIDs, that is non-steroidal anti-inflammatory drugs like injection fluxamine, meglumine at dose rate of 10 ml intramuscularly. And obviously, since the protruded mass is exposed, there is a chance of contamination, and to avoid this secondary infections, antibiotic cover of injection moxil at dose rate of 4 grams intravenously, injection tinophosphone at dose rate of 10 ml intramuscularly, and multivitamin supplementation is more important at dose rate of 10 ml intramuscularly. We can also go for some herbal preparations such as bolus practive. It can be given 2 boli twice a daily, and injection epidosine at the dose rate of 10 to 15 ml if the animal has completed the term and if there is partial opening of the cervix. So to conclude, summary, to save the life of a dam and the fetus, prompt attainment of emergency genital prolapse cases is very much essential. and proper management of prepartum cervicovaginal prolapse in buffaloes is necessary to cope with the economic losses of the dairy owners, and also it is useful to increase the productivity and reproductive performance of the animal. Thank you. These are the references which are being used for compiling this presentation. Thank you very much.